Try to relax, make yourself comfortable as much as you can. I'm going to do lymphatic of the neck and the face. First we will start from the proximal area, then we are going to the distal. So we will start from the clavicular area. Take a deep breath, ma'am. Inhale, and when you are going to exhale, I am going to push the fluid to go back inside. Not too much, just very gentle. Do it again. Exhale. So always remember, start from the proximal, then you have to go to the distal. Proximal to your heart. Again. Exhale. This three finger should be just above the collarbone. This is the collarbone. Then I press over here. Just little bit to lateral to the sternocleidomastoid muscle or on the scalenus. The movement should be like this. Take a deep breath again and exhale. Inhale and exhale. Same thing. Inhale, exhale. Inhale, exhale. Beneath the collarbone, just try to stimulate these glands. Just shake those muscles gently. That's it. Now going to the sternocleidomastoid muscle. Just hold it with two fingers and just shake them a little bit. Just to activate those glands. I'm going to do a little bit myofascial release also, which is not part of lymphatic drainage. But if you do myofascial, you feel like it's more effective. Whatever tight fascia or muscles are there, they should be got released. So drainage will be much more easier. So it's a combination of both. We're doing lymphatic and at the same time we're going to release the fascia also. I'm going to start with the deep neck flexor muscles like rectus coli, but it should not be painful. Just dig in your finger. This is your sternocleidomastoid. If you are not able to feel it, just raise your head so that your muscle will be pop up. Raise your head, ma'am. Not like that, from the pillow. So the muscles are popping out, so you can see the muscle or you can feel the muscle. Then put your fingers inside. Relax. Then you have to press and release this muscle. If you feel there is some knot or trigger point, just press and hold for a couple of seconds. Do some ischemic compression technique, then release. But make sure you are not doing both the sides simultaneously. One by one you should do. And try to avoid to press the trachea, otherwise you will feel like coughing, your gag reflex will be activated, which is not our target. Same thing, we are going to do the opposite side. Raise your head from the bed. Now relax. Putting my finger just beneath or behind the sternocleidomastoid muscle. Movement should be rhythmic. Should not press too hard. If it is too hard, then automatically patient will restrict the movement or make the neck muscles tight, which is not our expectation to do. So be gentle as much as you can. Now we have to mobilize the vocal cord. Just move it right to left, left to right, so that those lymphatic channels, this will be got drained. Start from the proximal part of your neck, then go to the distal part. While moving, you might feel something is like some crackling sound. You might feel that is normal, because that cartilage is moving one another, so that sound is normal. When you are going to the hyoid bone, patient might feel a little bit discomfort, but that's fine. Then the next twist, we have to use our both the hands. So one is going right, one is going left. The pressure should be very less. Now my left hand, index and thumb finger is holding the hyoid bone, and right hand, index and middle finger and the thumb is holding the trachea, and both are going to the opposite direction. Just do a couple of reps, might be 10-15 is good enough. Then we have to start from the scalenus. What we have to do, we have to place 3 fingers just beneath the sternocleidomastoid muscle and wait for a couple of seconds so that fascia should be softened and you can go inside. If you do it forcefully, your muscles will be activated, your muscles will be tight, so desired result you won't get. So it should be soft, gentle, and wait for the body's response to react. When you feel it's moving like butter, then you are doing perfectly. At the end, you can gently rub that area so that if there is some restriction over there, you can release. Same thing to the opposite side also, starting from the sternocleidomastoid. Waiting for relaxation, waiting for fascia to relax, and it will start moving smoothly. You don't have to push, just wait for the body's response. That's the fascia release technique. I'm going to place my hand beneath the neck. Middle, index and ring finger should be holding the neck, and thumb and little finger should be outside. It's a very relaxing technique. It should not be painful at all. If it is painful, that means you are putting a lot of pressure. After a couple of seconds, you start feeling like your hand is slipping. That means fascia is getting relaxed and movement should be easier. And gradually you have to turn the head to the opposite direction. Like right now, my right hand is going towards the right shoulder of the man, and my left hand I am pushing or tilting the head to the left side of the shoulder. Finishing part is more crucial. You have to be patient, so don't do it very quickly. Till the tip of your fingers is coming out, you have to hold it gently. Do it twice or thrice, don't do it too much, otherwise you are expending too much time on fascia releasing. 2 or 3 times is good enough. Max to max is 3. And make sure patient is not doing any movement. If patient involves in this movement, then definitely his muscles are becoming tight, so desired result we won't get. Both the side we have to do. Turn the head to this side. Try to relax. Focus on your breathing and don't try to help me. If your body is going into parasympathetic state, you start feeling there is some pulsating movement on the neck, or there will be some changes in skin color. That is absolutely normal. Pressure should be very gentle and very less. Putting pressure is not the target. Target is just to activate the lymphatic glands. That's it. Start from the temporal area, behind the ear, including sternocleidomastoid muscle and backside of the sternocleidomastoid muscle, splenius muscle, then forward up to the clavicle. There might be some wrinkles is showing over here, but that is not due to the pressure, just due to the skin texture. Both the side we have to do. It looks very simple, but it's not that simple. You have to control the pressure, otherwise not going to affect that much. Now the hyoid bone a little bit above, just a circular movement 10 to 20 times clockwise and anti-clockwise. Below the jawline, just put the fingers inside, but don't poke it, and just try to mobilize this area. A lot of lymphatic glands are there. While doing this area, you might feel there are a couple of nodules like structure. Those are like the lymphatic glands. Don't press too hard those areas, that's fine. When we are going to do the intraoral, in that time we can press a little bit harder. And while doing this, patient might start swallowing the saliva because a lot of fluid is moving here and there. That is normal. Now the facial part. General stroke, generally we do for facial lymphatic. You can do your own way also. Only the thing is you have to keep in your mind what are the channels, what are the lymphatic channels are there. According to that, you can do. You can repeat a couple of times more. It's a very gentle technique. It should not be painful. Sometimes we release a couple of trigger points over here. If we feel there is some tightness, like corrugator supercilii, occipital frontalis, people who have a tendency to clench their teeth while nighttime sleeping, which you call bruxism, they have overactive muscles in temporal bone, which we call temporalis muscle. So while pressing this area, patient might complain about the pain. Can you please clench, ma'am? Clench your teeth, relax. While clenching also you can feel there is some muscle contraction. So those are the trigger points or tight muscles on the temporal area, temporalis muscle. Just release a little bit. Release the fascia, and if you feel some trigger points, good enough. Sometimes this trigger point can create some radiating pain on the face if it is too active. Feel the zygomatic arch. Ma'am, can you open your mouth a little bit? Just 1 inch. Yeah, keep it like that. Just feel the zygomatic arch go a little bit up and release this area. This is also a part of your temporal muscle which need to be released. Pressure should be tolerable, it should not be too much. On a scale of VAS, it should be less than 6. Then below the zygomatic arch, you can press and release a little bit. It is not lymphatic. What I am doing right now is just releasing the trigger points. Relax now, close your mouth. Then feel the angle of ramus on your mandible. Go a little bit up. On the middle, you will feel a bulky muscle, which we call masseter, which is mainly responsible for our chewing. Left side, I am feeling there is some thread or like a taut band. Right side, less, but the right side is also there. So there is some trigger points over here. Is it painful, ma'am? Little? Okay. Then I'm going to check zygomatic major and minor, which starts from here. Sometimes people who have allergy to sunlight or bright sunlight, sometimes we just make a wrinkle on our face, so these muscles got activated. So sometimes these tight muscles also create a lot of issues, so they should be got release. Zygomatic major and zygomatic minor. Intraoral I'm not going to do today, might be sometime later. So this is all about lymphatic drainage of the fascia, on the face and the neck area. Done for today, ma'am. Now we are going for cranial.